Hello everyone, I am Ali Saad Al-Shammari, a fifth-year medical student from College of Medicine, University of Baghdad, interested in cardiology. Today I will talk with you about a very important subject, which is acute ischemic stroke. You know that acute ischemic stroke is the fourth leading cause of mortality in the United States, and it is one of the most dangerous conditions during human life. So, I will talk about the management of hypertension in acute ischemic stroke according to the guidelines of the American College of Cardiology. You know that one of the most important steps in the management of stroke is the thrombolytic therapy. But are all patients can fit for thrombolytic therapy? Of course not. The contraindications for thrombolytic therapy are previous intracranial hemorrhage. If the blood pressure more than 185, the systolic pressure more than 185 millimeter mercury and the diastolic more than 105 millimeter mercury. If there is a clinical presentation suggestive of subacute of subarachnoid hemorrhage, which is the most classical symptom for subarachnoid hemorrhage is the headache. The patient told you that this is one of the most painful things in my life. Also, if the platelet count is less than 100,000 microliter, and if the INR ratio more than 1.7, and if the prothrombin time more than 15, if there is a previous puncture in an uncompressible site for the previous 24 hours, if there is active bleedings like trauma or fracture. These are the absolute contraindications for thrombolytic therapy. So now we will divide the patients according to their condition, if they are fit or non-fit. The class 1 is the patients who are fit for thrombolytic therapy. We should give them the thrombolytic therapy when we lower blood pressure less than 185 millimeter mercury. So when we lower this blood pressure, the level of the blood pressure, we should give them thrombolytic therapy and then continue to lower their blood pressure to less than 180 and 110. These are the class 1 patients. The class 2 and the class 3 patients are the patients who are non-fit for thrombolytic therapy. We also divide them if their blood pressure is more than 220 and 210, or if they are more or less of that level of blood pressure. If they are more than 220 millimeter mercury, we should continue to lower their blood pressure 15% during the next 24 hours. If they are less than this level, we should also divide them if their hypertension is a chronic hypertension or initiating hypertension. If the hypertension is initiating, unfortunately, these patients cannot, the management cannot help and improve their condition. But if their hypertension is chronic hypertension and reinitiating, if their hypertension is just a chronic hypertension, we should continue to use blood pressure lowering regimens. And thank you very much.